I'm Dr. Generosa Grana, Medical Director of MD Anderson Cancer Center at Cooper. And with me today is one of my favorite patients, Erika. We've been on this cancer survivorship journey together for the last 2.5 years, and it's been a wonderful journey. I'm sure she doesn't think it's been a wonderful journey.
Actually. It's been very good, as good as it could have been.
So what is cancer survivorship? Cancer survivorship is the process of going through a diagnosis of cancer and undergoing treatment and coming through on the other side. About 16 million cancer survivors live in the United States today. A large bulk of those are breast cancer patients like Erika, because fortunately survivorship from breast cancer is improving on a daily basis due to early diagnosis, better treatments, etc. The journey of cancer survivorship, again, we think of it as beginning at time of diagnosis, and a lot has to be done in that process. So the first visit with the oncologist, you talk about treatment, you talk about whether it be chemotherapy, surgery, hormonal therapy. But we begin talks about survivorship early on, so the patient has a game plan, a path of what their future is going to look like. When are milestones going to occur? Oftentimes there's a point at which there is a natural transition to an official survivorship program, oftentimes at 5 years, but clearly the patient has to go in with an understanding of what their journey will be. We have a very formal process at Cooper. We have a survivorship program that is led by our nurse practitioners in collaboration with the treating oncologist. It actually begins with an end of treatment care plan. So once the patient is done with their chemotherapy, they sit down with the nurse practitioner for about an hour to discuss the pathology, the treatment, the drugs they receive, the long-term side effects that they can expect, the typical things that are done in that course, be it testing, labs, scans, etc. And then that journey begins. Along the way, we offer a tremendous number of resources, including complementary medicine, integrative medicine, focusing on nutrition and behavioral health, exercise. We offer support groups of a variety of classes, and the whole process is really meant to help the patient in that journey and the patient's family, because oftentimes this is not a journey that the patient is on alone. It's a journey for the patient and their family. So it's a process.
And there's a big transition, because when you are done with treatment, surgery or whatever, chemotherapy, radiation, there's that transition to go back to your normal life. Everybody says to go back to your normal life or whatever you did beforehand. And MD Anderson at Cooper is very helpful with getting you back on that track after all the treatments and the medicines and all of that. There's the rest of your life, hopefully, and you have to go back to doing something. So I think a lot of people don't get how much there is afterwards. And when you get told that you're good, you're done, there's a whole lot more. There's the before cancer and after cancer, and there's before treatment and there's after treatment. There's a lot that goes on behind the scenes that people don't really know about. They just assume that you're good, you're done, you're okay, and then they don't know all of the fears of recurrence, just the whole physical aspects, long-term, problems, osteoporosis, personally, different joint pains, aches, and this and that you just, you keep going on and you put that smile on your face, and people just assume that you're okay. But it's okay to not be okay. It's okay to have issues and to not always be perfect. You don't have to you don't have to be alone to cope with all of these different things.
Yeah, I think it's interesting. I think younger survivors are much more savvy about social media support and web. But I find that the older patients, even though they're not often going out to search for the information, their children are helping them to find it. Yeah. They're doing it for them. So I think in this day and age, social media is providing a lot of strength for people. The internet and the good and bad parts of the internet, because you can get really valuable information online, and then you can get really disruptive bad information that is confusing to patients and actually can be harmful.
Very, yeah. I think I don't know about, I guess you would deal with it more than I do, but men, like my husband with the whole diagnosis, men are fixers. So maybe men don't like the idea of support groups because they don't need support from other people. They're the fixers of the situation. So I think for men to sit around and talk, like women, we sit around and talk about whatever, right? We talk and, we complain and we support each other, but men, they just like to fix. They like to fix, and if something's broken and they can't fix it, they don't like that. That's uncomfortable for them. So.
And different people tend to gravitate to the things that work for them. So for example, our Dragon Boat team, they're a group of women that really feel comfortable together. They have this shared activity and they're very active. We have a support group, Sister Will You Help Me, which is a faith-based group for African American women, and it's a very different feel. Faith is a big part of that group. They support each other in every way. So again, there are many ways in which individuals can get support. I also don't want to forget the support needed for families and children, because oftentimes as parents of young children, the children do have needs as well. And there are those resources. We have a social worker, Casey, who is incredibly good with children. She often meets with parents to talk about how do we discuss the cancer diagnosis with young children. What books, what educational materials can we provide for the young child? What kind of camps can you do for the older child in the summer that may support them? So again, it is a family event. Survivorship cancer is a family event, and our job is to make sure that not just the patient has the support and the resources, but that the family has support and resources.
Yeah, I mean, my whole family, it was part of this. I actually sent my kids to a Camp Kesem, which I found through the internet. That was a camp for children whose parents have had any kind of cancer, and that was a great thing to do. And I mean, my family has gotten really involved with the race, because they saw, MD Anderson and Cooper, they, saved my life, and they would want to give back somehow. So it's also afterwards looking at ways to give back. I mean, that's what my family is doing. And I know people are involved with chemo bags, and other families get involved in a lot of different ways, which is great, because it is a family diagnosis. I mean, I had the breast cancer, but my family dealt with me. So I almost want to give back to my family for dealing with me.
We have a tea cart that goes around in the chemotherapy area, and it goes around every day, and it brings snacks and magazines. No tea. I don't think it brings tea, but it brings and it's interesting how many patients come back to do that and how many families come back to do that. We have businesses in the community that give some of those things, and it's just a feel-good thing. You're here sitting, getting chemotherapy, and just the thought that someone is thinking of you on that day is
there are
powerful.
a lot of ways to give back for the families that want to get involved that are super helpful, and that's definitely one of them. Even kids can do, like, have their friends come over and make these snack bags, and the patients, when they get them, because I'm one of those people that have come back now to do the tea cart with no tea, snack bags, and give them out, and people's reactions, I mean, I got the bags and I loved getting them, and now when I give them out, people are so thankful. I mean, you make their day by giving them a bag with juice and crackers and mints and chapstick in it, and it's a much better feeling to give it than to get it. I'm more of a giver than a receiver. It's nice to receive, but it's even better to give. A big part of cancer, I think, is you lose control. You've lost control of maybe your body and things that happen. And when you don't have control of things, it's very atypical for me. So I kind of took control of what I could and made the chemotherapy parties something that I could control, or made the exercise things something I can control. So I kind of took my own path of doing things, and that was a big way of coping also.
We think oftentimes that ringing the bell, as our patients do at the end of chemotherapy, should be this amazing celebration, and it is an amazing celebration. I've seen patients with entire families coming for the end of treatment bell ringing, patients coming in limos for end of treatment bell ringing. But the reality is that for many patients, although there's that celebratory happiness that this miserable treatment is over, for many patients, that's really the beginning of a lot of emotional hurdles that need to be overcome.
Whole different thing that you're dealing with. And I know for me, the ringing of the bell, yes, I actually didn't decide to do it until the day of. I really didn't want to do it for a couple of reasons. I didn't want to do it because of A, the fear of recurrence, and B, out of respect for people that are there that are never going to be able to ring that bell. So I felt a little, I think there's a lot of survivor's guilt too, with cancer, which is a whole separate thing. But there's definitely survivor's guilt when you are in this. You meet people that don't do well, that do pass away, that don't make it to survivorship. And so there's a lot of survivor's guilt from that. So I really was hesitant to ring that bell. And I almost kind of got, like, you should do it, because everybody wants that celebratory thing, that enthusiasm. And it was great. I did do it, and it was great and wonderful and very emotional. But if you don't do it, that's okay too. There's no right or wrong.
But I warn my patients that oftentimes that those first 3 to 6 months after chemotherapy is done, you're now moving on to reclaim your new normal life. But that can be a time of emotional upheaval. You're worried. All of a sudden, you're feeling better, so you're not focusing on the disease as much. And you have more time to think about risk of recurrence. You have more time to think about what you've just gone through. So oftentimes the beginning of that survivorship journey can be difficult.
And it's almost scarier because you're not actively doing anything. When I was going through treatment, I had a plan. Okay, you do chemotherapy, you have surgery, you have radiation, you have whatever you have. Then when you're done, what are you doing to keep this from going back? So, that's a whole another thing. That's all in your mind. You may be physically feeling better, but your mind, you can't always, everybody says, I wish there was a switch, I could shut it off, but there is no switch. So how do you deal with that?
I think a big part for patients is to look at their medical support, which is the physicians, nurses, nurse practitioners that are involved in their treatment, to look at their families as a great way of supporting the survivorship journey, but then to also look at other resources. We have resources here in the Cancer Center, but there are community resources. There are organizations in our community that are actively doing things to support patients living beyond breast cancer, the Komen Foundation and others. So the key as a patient is on this journey is to try to identify the resources that are right for them, that fit them at that point, and they may change as time goes by.
Well, there's a ton of resources. Not everybody has a great family. Like, I was lucky. I had a great family, I had a great support system, but not everybody is lucky enough to have that. But so like you said, you have to go out. There's a ton of resources out there. And with all of cancer, it's very individual, and you have to find what works for you. What works for me may not work for you. What worked for you may not work for me, but you have to find something. And luckily, in the age of social media and the computer, there are resources, there are people, there are groups, there are places, there are ways to cope, and it's just a matter of finding what works for that person.
In the breast cancer population, there tends to be much more focus and interest in support groups. We have a Dragon Boat team that many of our patients belong to and get great support from. Some people run, and you have organized this great race, and that brings others interested in running to work with you on that. But there are people that have other mechanisms, that have other routes. So I think the key is finding that right thing. Yeah. Men, on the other hand, are not that interested in support groups. They want education, but when we've tried to do support groups for our male patients with prostate cancer, for example, there isn't that interest in that focus. So they are looking for other things. And the key is to provide as many resources as we can so people can find what fits them.
Yeah, because I think a lot for me, it was like the whole cancer card, you can use your cancer card for a certain amount of time, but it expires. That cancer card's only good for 1 year, 2 years, 3 years, whatever it is. And once it's expired, throw it away, it's gone, it's done. And not that I ever use a cancer card, but it is a part of daily life. I still see you every 6 months. There are follow-ups. Like, when you're done, you're not just done. The follow-up period it's usually 5 years. So for 5 years after treatment, I'm still coming in to see you. There's still skin anxiety. There's still lab work. There's still tests. There's still part of cancer. There's the remnants of it maybe, but it's still there and still a part of your life. So even though everybody thinks that you're good, it's still a part of your life, as much as you want it to be or as little as you get it to be.
The recognition of cancer survivorship as an important part of patients' care is there. Across the country, the National Cancer Institute and others have really focused on survivorship as an important period in patients' lives, understanding it and doing research as to what those transitions are, how patients cope with the transitions, what patients' needs are. So there's a tremendous amount of research being done across the country to try to understand the whole process of survivorship and how we might better serve you, how we might better as a cancer program meet the needs of patients at every step of their journey.
Yeah, I think mental health awareness is a big thing just in the general public. I think it's even more so in, there's a whole stigma behind mental illness and mental health, and people are afraid to reach out for help. And I know I've talked to a lot of people about like cancerversaries, like even I happen to remember all my dates. I could rattle off every date of every single thing that I had. But some people really don't remember their dates or choose to tune it out. But I've heard from people that around their diagnosis date, whether they realize it or not, they start feeling some kind of way and things get back, but it's almost subconscious, and they know that they're feeling unhappy or not good or stressed or anxious, and then they look at the calendar and realize, oh, this is, whether it's 2 years ago, 5 years ago, 10 years ago, it's a very emotional time still, year after year.
And patients going for scans, if you're getting yearly scans or a yearly mammogram, it often can be a time when a lot of this resurfaces. The other big time when a lot of this resurfaces is if another person is diagnosed with cancer or, heaven forbid, dies from the disease. That just brings up a tremendous amount of flurry of activity in many of our patients.
Absolutely, yeah, because you don't really know how it's going to hit you until it does, and that's where that survivorship guilt does come in.
So Survivors Month is really a recognition of the fact that we have increasing numbers of survivors in our society, the fact that they are thriving and an active part of our community, giving back, and it is a celebration. The whole month is a celebration of survivorship. We at Cooper have a tremendous number of activities planned during that month. They happen in each of our sites, Camden, Willingboro, Voorhees, and they are activities oftentimes that involve our staff. The important thing is that every person in the cancer program, and actually outside of the cancer program at Cooper itself, has a real tie to MD Anderson Cooper. Whether it is our pathology team, our radiology team, our valets, our lab personnel, our nursing, clearly, but everyone has a connection to the cancer program and wants to be part of that, and we want them to be seen as an important part of that journey. So the care team is not just the physicians, the nurse practitioners, the nurses, the MAs, but it's also the housekeeping staff that make sure every day that this place is looking beautiful and clean. It's the valets that often are highlighted by patients as that face, that smiling face that they meet when they come in and that they see when they leave at the end of a very exhausting day of chemotherapy. It really is a big group of people that are involved in your care.
Yeah, definitely. I mean, I had 16 chemotherapy treatments, so I was here, and seeing the same faces over and over and over. And so, I mean, as a nurse myself, the nurses obviously, I really got to know them. They took their time. They answered every question, 50 million of them that I had. But the valets, you see the same person and they're there with a smile. The lab people, like you said, the housekeeping, even the secretaries making the next appointment. Sometimes just making another appointment after appointment after appointment, and when you're making them, it's nice to see like a smiling face, and they're there, and they get to know you. I mean, there were times like one week I had hair, the next week I didn't, and they're like, "Hey, Erika, how are you?" I'm like, "How you know me?" I look a little different, but they get to know you, and I walk through here now for appointments, and just walking up here, it's like, "Hey, Erika, how you doing?" And that was Karen from the lab. I mean, you get to know everybody, and they get to know you. And as a patient, you think, that you're just, a lot of places you could be a number, like, oh, they don't know who I am. But here, like, when they're using my name, they know who I am, with hair, without hair, long hair, short hair. They recognize you. They know who you are. So it is literally like a team, a full team effort.
And for us, June is an opportunity for that team to all celebrate that, to celebrate that they're a part of your journey, that they've played a role,
part of my life.
and
Yeah.
that they're a part of it.
Yeah. I mean, I really do. I really do feel the sun more on my skin. I feel the breeze in my hair. I mean, I really do take little moments to just kind of look around when I'm at, the line at Target, and I just kind of look around. I'm like, okay, I hear people complaining about coughing or, their car costing money or little things that, I complained about before too, like the mundane stuff. And, you really, I'll find myself even talking to my husband. He's like, oh, the light turned red again. I'm missing every light. I'm like, who cares? Like, who cares? It's those little things that people get caught up on that is not, they're really not, they're not important. And I definitely, I'm still type A, I'm still a control freak, but I've learned that I cannot control everything and to not really, it's so cliche, but not sweat the small stuff.
The bonds that I form with my patients are amazing. I just value them so much. I do.
Agree.
It's an amazing relationship. And at the 5-year point when we say, hey, you're in the survivorship program now, to me it's such a heartwarming thing, because that's success. That's the fact that we've been able to get you to that next step, and life goes on. And I'll still always be there in the background as part of that next step. But it's just,
you can't get rid of me that easy.
No.
I'll still be around.
It's just such an amazing relationship. So wonderful. I find that the survivorship course is always an opportunity to re-educate and reaffirm that oftentimes prognosis is good, that some of the fears that you've been having may not be truly real. So I want people to be comfortable bringing out their questions and their fears at every point across the journey.
Yeah, I think it's hard for some people in the beginning. They're so overwhelmed with information and Google. Everybody's Dr. Google nowadays, and you get on and you just see so much information that you have to really be able to write questions down during, the non-appointments when you're just thinking about things, and I would always tell everybody to have a little notebook, because you're going to think of things at 3:00 in the morning when you get up to go to the bathroom, or you're going to think of things when you're making scrambled eggs in the morning, and then you forget about it, and then you get to the appointment and you leave there and you have forgotten what you wanted to ask. So always everybody has phones now, have a little folder on your phone to ask questions. But it was nice for the end to have everything a very comprehensive thing of what everyone has had done. I tend to remember more, but some people, if you don't know the terminology, you don't remember the medicines that you were on. It's all listed in one comprehensive packet.
So the end of treatment care plan was devised with the idea that it's one place where everything resides. Your surgical treatment, your radiation doses, your chemotherapy, everything in features about your pathology, side effects to watch out for in the long term. And that document is shared with your primary care provider, with your surgeon, your medical oncologist, your radiation oncologist, and you have it, so that it's always a living document of what you need to be thinking about.
One other thing I wanted to mention, I don't know if other places do it, but I love at MD Anderson Cooper, the way you guys have tumor board, and everybody knows everything. So they're all connected. There's actually meetings where you guys sit and talk about our tumors or whatever.
That's right.
But everybody's on the same page. You don't have to say, well, did you get the report from this or did you get that? It's all right there. You all talk about it, and it's one-stop shopping.
Yeah, I think it is the concept of the team. So cancer is no longer a disease or a diagnosis that's taken care of by one physician. It's a team. In breast cancer, it's medical oncology, surgery, radiation oncology, plus physical therapy and rehab if you happen to have lymphedema or limited range of motion, plus nutrition, plus behavioral health. So there are a whole group of individuals that revolve around you that offer different things, and it is not just a one person team. So it is very important for the patient to form that team, and it's very important to continue to manage with the help of that entire team.
Yeah, and that's all what Cooper and MD Anderson has been, is a team.
Yeah, I think we have a great team. We have a great group
Very
of
good
people.
team. Yes,
but because we have great patients also.
And we have great doctors.
Yeah. So again, my message for survivorship is to stay strong. This is a long journey. We want you to have a long, long journey with this diagnosis. Take advantage of all the resources that are out there, whether they be on our website, whether they're at the National Cancer Institute website, which is available to patients. There are just tremendous resources, and the key is making sure you feel supported and you feel that those are available to you.